Good morning, good afternoon, everyone. I hope you can all hear me well. Welcome to our final webinar for the Access to Justice project at CNPA. My name is Benedict Schöpflin. I'm the Executive Director of CNPA. I would like to start by thanking you for showing up today under these very special circumstances. We hope that you are all staying safe out there, and we understand that things are a little different for everyone these days. So we truly appreciate you being here and listening in today with us. So what we're going to do is we're going to start with the very simple we'll say housekeeping slides, just to kind of help you understand how everything is going to work. So first things first, as you might have heard the message earlier, the webinar is being recorded, so please remember to mute yourselves. On the computer, that looks like a little green microphone icon. So just click on that until it's red or orange, and that means you'll be muted. If you're listening in on your phone, you can either press the mute unmute button or you can dial *6 on your keypad. If you're attending via computer, make sure that your sound is turned on or up and that your headphones are plugged in the right jack. And if you need to connect by phone for the sound at any point, here are the numbers that you can use. So Canada toll-free, Canada long distance, and here's the access code you'll need to enter. If you're experiencing any kind of issues, if we're talking about connection issues, the easiest way is usually to close the window, hang up, start again. If there are some sound issues, either a strange echo, a muffled sound, let us know via the chat box that you can see on your control panel, and we'll see what we can do. A few more things before we get started. We're going to have a short Q&A at the end for 10 to 15 minutes. So if you have questions that you wish to ask, use the chat box on your control panel at any point during the presentation. I'll be collecting all the questions and we'll go through them at the end. And if you cannot stay until the end of this webinar, we're recording it and we'll be uploading it along with the slides of the presentation later on today. Okay, so now before we go any further, it's very important for me to say that I acknowledge that the land on which I live and work is the unceded territory of the Coast Salish peoples, including the territories of the Musqueam, the Squamish, and the Tsleil-Waututh nations. If you haven't heard about our project, this webinar is going to offer you an overview of what we've been up to for the past 3 years. We've been working on a project entitled Increasing Access to Justice for Older Adult Victims of Sexual Assault, a capacity building approach. This is a project that's been generously funded by the Justice Canada Victims Fund. And you can find all the details about the project, as well as a link to all the resources that were gathered, curated, as well as created for this project on cnpa.ca. I also added the link to this page in the chat box, so you can find it there. Now, Kathy, if you're ready for us, I'm going to mute myself and let you take over.
Ready to go.
Perfect. Let me swap to your screen right away. And you're on.
There we are. Perfect. Thank you, everyone. As Benedict mentioned, we very much appreciate everyone joining us today in this, I hate the word unprecedented, but it's really the only word that seems to fit these days. So we're really excited to be winding down our Access to Justice project. We feel that we've developed some fantastic resources with this project, and we're excited to share the ones that have already been released and some sneak peeks on ones that are going to be released in the very near future. So, without further ado, a little bit of background about me. First of all, I would like to also acknowledge that I work and live in Treaty 1 territory, the traditional territory of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and in the heart of the Métis Nation. For those of you that may be wondering why we have two different land acknowledgements, Benedict is located in British Columbia, and I work out of Manitoba. So really briefly about me, I have been the CNPA board chair since 2016. My background is nursing, as well as healthcare education, and staff education on the front line. So as you can imagine, working from home at this juncture is not an option for me, so I'm happily at work. About the CNPEA, so again, for those of you that may not be familiar with us, we are Pan-Canadian. We are a nonprofit organization. We connect people and organizations because we want to foster knowledge exchange, recognizing that there's amazing work that's being done across our country, and people may not always have the opportunity to connect. So we also want to advance program and policy development at local, regional, provincial, territorial, and national levels, because our overarching goal is and always has been preventing the abuse of older adults. You can see additional information on our website, cnpea.ca. And another little repetition, but important to note, I will likely defer back to calling this the Access to Justice Project, but the full title is Increasing Access to Justice for Older Adult Victims of Sexual Assault, a Capacity Building Approach. And the project started April 1st, 2017, and we will be concluding at the end of this month. And we are very generously funded again by Justice Canada Victims Fund. Some acknowledgement to the important people that have made this project possible, that have tirelessly worked on getting the resources developed, getting the literature reviews developed. So the project consultant, Myrna Dawson, professor and director of the Center for the Study of Social and Legal Responses to Violence. She's out of the University of Guelph. Dr. Amy Perrone, postdoctoral fellow at the University of Guelph. And please ignore the next sentence. I meant to take that out. She has now completed her PhD and is working out of the University of Guelph. Our very own executive director, Benedict Choplan, is also the project coordinator, and she has done amazing work putting the information that's been gathered into some beautiful documents that are going to be shared far and wide. And our project advisory committee, people of amazing experiences from all across the country that have offered their advice and their guidance and their feedback to make this project, or to make the resources relevant and useful for everyone that is working in a field that deals with sexual assault against older adults. So what we know. So this is information that that we were aware of coming into this project, and this was part of the impetus of wanting to do a project like this. Is we understand that our population is aging, and we also are aware that approximately 4 to 10% of Canadian older adults experience some form of abuse, and only a fraction of these cases are reported. So very simply, elder abuse is a single or repeated act or lack of appropriate action occurring within any relationship where there is an expectation of trust, when this causes harm or distress to an older person. So sexual abuse of an older adult is looking at sexual abuse across the lifespan. We recognize that sexual abuse across the lifespan is underreported, but it is described as the most underreported and the least acknowledged type of elder mistreatment. Elder sexual abuse refers to sexual victimization that is perpetrated against an adult aged 60 years or older, and includes a series of hands-off and hands-on behaviors. And our literature reviews actually go into considerable detail on what those behaviors entail, and we have included that into our fact sheets as well. Some of you might be aware that there is a national survey, the biggest survey that was done on the mistreatment of older Canadians. And we've taken some excerpts out of the sexual assault piece. So their definition was direct or indirect involvement in sexual activity without consent. The majority of perpetrators were not family, but they were male. A very small percentage lived with the victims, and over almost 18% had mental health problems, and over 20% had problematic alcohol use. 1/5 of the abused had previous experiences with sexual abuse. So for those of you that have knowledge and information about elder abuse, some of these statistics do not line up the same way from what we know about elder abuse that is not sexual abuse. We know the statistics do show that family members are much higher likelihood to be the perpetrators. And many of the perpetrators do live with the victim. Sexual abuse, the numbers are quite different. So in our first literature review, which has been released and is available on the website, we discovered and we confirmed that women are viewed as older at younger chronological ages than men. And while aging men may still be viewed as sexually alluring or distinguished, aging women are often viewed as unattractive, asexual, and in some cases even useless, although there is a movement to change such images and stereotypes. By viewing older people as asexual, they may be ignored as potential victims of sexual abuse or assault. Now sometimes we use those phrases interchangeably, sexual abuse or sexual assault. I do want to pause here and just talk a little bit about the difference in those terms. So sexual assault is any unwanted sexual act or behavior which is threatening, violent, forced, or coercive, and the person has not given consent to. Sexual abuse is often referred to a sex act as described in sexual assault, but it's committed against a vulnerable individual by someone in a position of power or authority. So it's not common for researchers to acknowledge the intersection of violence and aging because older women have traditionally been overlooked in literature pertaining to violence against women and intimate partner violence more generally. So some of the societal misunderstandings, the big misunderstanding, the myth that was identified is that these crimes are fueled by sexual desire and rape is an expression of passion. So when we're looking at ageist assumptions that older adults are asexual or unattractive, then it's difficult to get out of that mindset to say that they can be victims of sexual assault. It makes acknowledging that sexual violence against an older person difficult. In reality, sexual assault involves the use of power and control over a vulnerable person. It is not passion. So not only does society underestimate the possibility and likelihood of sexual abuse against older adults, it also underestimates the potential or actual victims. In Canada, the trend in the nationally representative Canadian victimization studies on older adults is to combine categories of physical and sexual violence. And this becomes quite problematic because just even looking back at the potential perpetrators of sexual violence, there is a difference in what we expect to see from perpetrators of physical violence and emotional violence and even in financial violence versus sexual violence. So when these two categories are grouped together, it's harder to figure out what the data is saying about sexual abuse and sexual assault and how we can respond in the best way possible to ensure that our older adults are able to report, are able to find the supports that they need. The sexual assault of older women, a criminal justice response in Canada, did a comprehensive case law review of sexual assaults over a period of 2 decades. So we know from their case law review that almost 4% of cases of sexual violence throughout Canada involved older complainants. So that's the reported statistics. So I'd like to again remind you that this demographic is the most underreported when it comes to sexual abuse and sexual assault across the lifespan. The characteristics of the people that are sexually abused: older women are much more likely than older men to be victims of all forms of mistreatment, and this includes sexual abuse and violence. Older female victims were more likely to live alone or to have physical and cognitive impairments, which again makes reporting problematic. Victimization occurs most often in the victim's home. And poor physical or mental health, as well as physical or mental disabilities, have been associated with higher risk. Oh, sorry. The characteristics of the perpetrators. What we know about the perpetrators of sexual violence against older adults is limited. There are significant gaps in the literature and in the research. The vast majority of the information we do have are derived from case reports at police stations or other agencies, and they're not going to be as comprehensive as we need them to be because so many people don't report. So few studies focus on those who victimize older people. We know that the perpetrators prey on victims who are easy to overpower, unlikely to report, and will not be viewed as credible if they do report. Perpetrators who target older women tend to display more severe behaviors. So there's more rage, there's more anger, there's more sadistic intent, and or a desire to be in control. And they're more likely to engage in brutal violence involving a weapon resulting in injury or death. So from the limited information that we do have from the case reports, those are some things that we can say about the perpetrators. Some other correlates are that Indigenous women are disproportionately victims of sexual violence across the lifespan, including in older age. Individuals who have activity limitations are also more likely to experience sexual violence than those without. Lower levels of income and education are associated with higher levels of sexual violence. Previous sexual victimization was found to be the strongest predictor of sexual assault among older adults. So there is a potential, if there's intervention and supports at a younger age, that there could be some prevention occurring, or at least some additional supports that could be provided as women get older. And lower levels of social supports were found to be associated with all types of abuse. So people that are isolated socially or don't have a whole lot of social connections or community supports are at higher risk for all abuses and sexual abuse. So from the first literature review, some of the suggestions for responding to sexual assault of older adults include challenging societal values regarding older women and sexuality. That means having those conversations, recognizing that this is not an issue that goes away when someone turns 55 or 60, that this is across the lifespan, and challenging some of those myths. Recognizing that older women's vulnerabilities, recognizing that there are additional vulnerabilities for older women when it comes to sexual violence. Educating older persons about sexual abuse. We, as younger generations, may have been exposed to the Me Too movement on social media, have had some additional education in school around consent, may have seen some of that in the media, but we can't necessarily assume that older adults have had that same information shared with them. So awareness of sexual assault of older adults has to also include ensuring that older adults understand what sexual assault is. Improving education or training for staff on signs, symptoms, and patterns. Sorry about that. Improving education or training for staff on signs, symptoms, and patterns and risk factors of abuse associated with victimization and perpetration. So that does mean gathering more information to really get a better picture of people that are at risk and people that are more likely to be perpetrators. Taking immediate action to prevent compromising evidence. So as frontline workers, it is important that we do recognize when somebody comes and reports, that we are able to connect them with the most appropriate supports in the community. The importance of not blaming the victim by linking caregiver stress to abuse. That is actually problematic for all types of abuse of older adults. Is deferring back to caregiver stress as a reason or justification. So there is no excuse. There is absolutely no excuse for any sort of abuse of older adults. And we need to move beyond the awareness phase. We need to develop, implement, and test social and legal interventions, specifically for sexual violence of older people. So now you're going to get a sneak peek of our second literature review. So we are just finalizing this document, and it will be available by the end of this month on the CNPEA project page. So the second literature review focused on key resources and strategies. So the researchers identified practical strategies for prevention, identification, and intervention when it comes to sexual abuse of older adults. The review also stresses the importance of tailoring prevention, identification, and intervention specifically to older adults, recognizing that it is a demographic that may not fit under the standard gender-based violence or domestic violence or abuse or shelter model. There may be additional supports that need to be put into place. So grouping it as all, an all women shelter is not necessarily going to reach the older adult population. Methods and approaches for addressing sexual violence in younger adults are often not applicable or not necessarily applicable. There are additional vulnerabilities of older adults that have to be taken into account. And although older victims of sexual abuse may require more assistance and specialized help, they typically receive less services and interventions. There is a gap in our current approach to elder sexual abuse. So some of the strategies for prevention, so combining multiple strategies is designed to reduce or mitigate risk factors for sexual violence, victimization, and perpetration, which includes awareness campaigns, training, and institutional policies. Prevention approaches are multifaceted. We should be aiming the approaches at older adults, care providers, advocates, and a larger society as a whole, really looking at those ageist beliefs that further perpetuate the myths that are out there around sexual abuse against older adults. And I can say that with this project, this is what we attempted to do, and you'll see when we talk about the fact sheets that it is geared towards multiple audiences. So looking at the education and awareness campaigns, challenging those myths, materials specific to older adults, facilitating those discussions between care providers and older adults, ensuring that care providers feel comfortable having conversations like this. Maybe, depending on the role, it may not be an in-depth conversation, but recognizing how to respond and what kind of resources are available. And that also includes bystander education. The training initiatives should include long-term care staff, should include caregivers, should include advocates, and there should also be an emphasis on zero tolerance of abuse towards older adults and a clear articulation of organizational responses. For policy development and implementation, due diligence in recruiting, screening, employing, training, and supervising personnel. There is still a large gap in our frontline workers, the workers that have the most contact with older adults when it comes to providing supports for activities of daily living. Mandatory education, there are certain mandatory education and training that have to occur, but it's not consistent across the system, and that needs to improve and that needs to change. Teaching those individuals the skills to assist with activities of daily living is definitely important, but preventing elder abuse should also be part of mandatory education and training throughout both their education and their careers. There should also be a staff response and management of hypersexualized behaviors among those with dementia and other cognitive impairments, recognizing that an abstinence-only approach is not necessarily the best option, and trying to figure out with client-centered care, patient-centered care, wherever the organization is focused, that there are multiple different ways to approach a situation. Strategies for encouraging disclosure and identification. Older victims face barriers to disclosing experiences of sexual victimization. So some practical suggestions and guidelines for care professionals and service providers to encourage self-disclosure are important, because this would also increase the likelihood of recognizing and identifying indicators of sexual abuse when victims hesitate to, whether they choose not to or are unable to disclose their abuse experiences. It is important for those professionals and those support individuals to be able to continue the conversation or support the individual in whatever way they identify. We also need routine and regular assessments and screening, including elder abuse in conversations when we are working with, from a professional perspective, when we are working with older adults, asking those sometimes difficult questions, avoiding assumptions that an older person with a diagnosis of dementia or other cognitive impairments is unable to disclose their experiences. Taking a trauma-informed approach to inquire about potential abusive experiences. So for those of you, some of you may be aware that there's more information out there for trauma-informed care. And this is very important when we're talking about sexual abuse of older adults, particularly recognizing that the risk is higher for elder sexual abuse when there is a previous experience of sexual abuse in a person's life. So really recognizing that trauma-informed approaches best support individuals. Training and awareness for healthcare professionals and care providers on ways to identify potential victims of elder sexual abuse based on nonverbal or behavioral changes, particularly important for individuals with dementia or other cognitive impairments. Some strategies for intervention. Once sexual abuse has been disclosed or identified, we need services, safety planning strategies, outreach, and responses that are tailored to address the unique needs of older victims. Programming and services designed specifically for older adults with input from older adults. So there should be considerable involvement from older adults when these programs are being designed. Peer support, particularly looking at the trauma-informed care approach, peer support is a viable option, although it does need to be something that is looked at quite closely, but training older adults to provide that peer support. Domestic violence and sexual assault centers and services should be inclusive spaces that are welcoming to older victims of sexual assault, and not just welcoming, but also supportive of and recognizing that additional supports or different supports may be needed. Some other strategies for intervention, so looking again at that training and education, mandatory training for care and service providers, so they're aware of actions to take in the aftermath of sexual abuse. And criminal justice professionals should also receive training regarding appropriate ways to respond to older victims of sexual assault. Cross-agency collaborative approaches help with coordination in the community responses, particularly focusing on the unique needs of older victims of sexual assault. Just speaking for my own role in my day job, collaboration with other organizations is vital to ensure that communication and support is available from a wide variety of providers. Sexual abuse advocates also need to help older adults navigate available services and supports, including helping with guardians or loved ones, talking to them about the impact of sexual victimization in later life. So again, we're seeing an increase in information out there for sexual abuse, sexual assault, but very little of it is actually looking specifically at older adults. So these are some existing resources and tools that are included, or that will be included in the literature review that will be released at the end of this month. This is not an exhaustive list. There are definitely more in the literature review, but I do want to highlight that they are separated into resource categories. So you can see resources for older adults, for service providers, for support groups, for criminal justice personnel, recognizing that different people are going to need different information. So the CMPA has taken some of this information from the research and from the literature reviews and developed our own fact sheets for distribution. So the fact sheets include definitions of sexual abuse, some examples to really clarify and make quite clear, particularly thinking of individuals that may not have had the benefit of the Me Too movement or other information about sexual abuse and assault, identifying who's most at risk, identifying the likely perpetrators, what someone may feel, and what caregivers might see, and where they can go and get support. So I've taken a few pages, a few excerpts out of the fact sheets. So this first one is a fact sheet for older adults, really identifying what sexual abuse is, and then giving 12 different types of examples of what it could be. And I would just like to remind everyone that if you feel like I'm going too quickly in any of these slides, please remember that this this presentation is being recorded, and all of these slides will be available for download on our website. And these fact sheets are also available for download on our project page. So this next page is still out of the fact sheet that's targeted towards older adults, looking at who's the most likely to cause you sexual harm, what to do if they have been harmed sexually, and really stressing that they have the right to live free from all types of deliberate harm and abuse, and they have the right to safety and security, and that they are not alone. There's no excuse for abuse ever, and abuse is not your fault. We're recognizing that victims of abuse are likely to, maybe justify isn't the right word, but are likely to internalize some of that abuse. And if only I had been statements are not uncommon. So some common feelings and reactions after being harmed, and then looking at what can I do to stay safe from abuse and increase my safety. So some real concrete, if you're in immediate danger, call 911. If you can, try to get to a safe place. If you don't feel like you can leave right now, you can prepare a safety plan, right? Reaching out to people that you can trust. So the next 3 pages are excerpts from the fact sheet for the caregivers. So communicating who is at risk, separating out both the difference between adults living in the community and adults living in long-term care settings, identifying who the perpetrators are, looking at the general characteristics of sexual abuse, not necessarily definitive of sexual abuse, but communicating that these are red flags that may be useful in identifying a potentially risky or abusive situation. And providing some information as to what caregivers can do if they become aware of sexual abuse. So the goals of the fact sheets are really to communicate in a very clear manner to both older adults and their caregivers what options are out there and what is available and what kind of things might they see or might they be looking for. The next thing that the CNPA developed with the information from this project are some research snapshots. So each snapshot features a relevant research study or resource from Canada or an emerging topic or emerging topics that have been identified in other countries. Each snapshot also identifies how this information can be used by professionals to guide policy change and improve the work we do. Recognizing that information is valuable, but it's also very valuable to identify how we can use this. So again, all the snapshots are available on our project page on the website. So we have 4 snapshots. One summarizes research on resident abuse in long-term care. One summarizes research on criminal justice responses to sexual assault of older women in Canada. One summarizes a critical review of the current knowledge base and literature on the sexual assault of older women. And one summarizes the first comprehensive review incorporating empirical research on sexual violence against older women across multiple disciplines and fields of study. The CMPA has also developed 2 learning briefs, one focusing on sexual assault in later life, and one focusing on elder sexual assault in long-term care facilities, looking at key findings and trends. And each learning brief has a companion document that has recommendations for research, policy, and practice. Throughout the project, we've also hosted a number of webinars, which are, again, all available online to download, or you can download the slides, or you can take a listen to the recordings of the webinars. But we've had individuals that from across Canada that have focused on topics that are relevant to access to justice for older victims of sexual assault. If I do say so myself, they're quite good. I learned a lot in these webinars, and I'm quite grateful that they are publicly accessible. So what needs to happen now? So we've come to the end of the project, and our researchers, along with our advisory committee and the project team, have identified that there are some considerable knowledge gaps. What we know about sexual violence victimization among older adults in Canada is limited. We need more information. The literature is often sparse, or pardon me, the literature is sparse and often fails to focus specifically on sexual violence. There are definitely methodological shortcomings, including small sample sizes or convenient samples. And this impacts the ability to generalize or draw concrete conclusions. So we can, with the information that we have provided to us, try to identify characteristics of abused or abusers, but we don't have enough information to make those conclusions concrete. So what we're looking for, what we're hoping, what we want to see is a national strategy that assesses the incidence, prevalence, and characteristics of the experiences of sexual violence amongst older women in Canada. Sexual assault is the least likely form of elder abuse to be disclosed and the least likely form of sexual violence to be disclosed. And the private nature of sexual victimization of older persons, coupled with ageist assumptions regarding the sexuality and sexual health of older adults, complicates the identification and recognition of elder sexual abuse substantially. We also need to examine the longitudinal impacts of elder sexual abuse and the need for research on perpetrators' characteristics, including the examination and evaluation of treatment or programs for perpetrators. And there's also a need to include older persons' voices in the development of any interventions, any policy initiatives, any programs that are looking at specifically supporting older adults. There should be a large component of older adult voices and feedback and advisory committees to guide that work. So you can still, again, visit cmpa.ca for all project material and additional resources that we've gathered throughout the 3 years of working on this project. The materials are wide-ranging, and there's something for everyone, from healthcare providers, caregivers, older adults. Our project coordinator has really built up a fantastic repository of information in relation to older abuse or older adults and sexual abuse. That was a little bit quicker than I anticipated, but got some time for questions.
That's great. Thank you, Kathy. Okay, well, and also I'd like to add thank you to all the people who have participated to the advisory committee, to Dr. Dawson and Dr. Perrone for their work on this project, because it was a lot of obviously research and a lot of legwork to gather that information. And we hope we gave you a satisfying overview, but now is your chance to actually ask some questions. So as I explained at the start, even though we're in a smaller committee today, it's easier if you type out your questions in the chat box. So if you can, if you have a keyboard and a computer in front of you, go ahead and type your questions. If some of you are only on the phone, then now is your chance to unmute yourself and ask a question out loud. Just announce yourself, say your name, and ask away. And while everybody types and gets ready, I'm just going to get back to sharing my screen, so that I can share a few more informations with you. Okay, so while you type and think on your questions, if you have questions that come to you later on today, you can always get in touch with us. Either email me at the email address on your screen, benedicts.cnpea@gmail.com, or you can get a hold of Kathy as well directly. Both our email addresses are on the website. You can find us on social media if you feel so inclined. These days, it's we do a lot more sharing about COVID-19, obviously, but we do cover a lot of ground, and we always share updates about our new project releases. And as Kathy mentioned during her presentation, the second literature review will be ready by the end of the month. And once again, some of the key concepts or key documents used will be broken down in separate, more easily digestible documents as well. So keep checking back until, I would say, mid-April. And if you want to stay in the loop, you can subscribe to our monthly newsletter. The link is right here. You can also register directly on our website. It is free, and we only send one newsletter per month. Okay, now that I've said all this, let's see. Do we have anyone? No, no questions yet. I think everybody's being shy. Well, if you are looking to unmute yourselves, this is a reminder. You can click on your little microphone icon or do *6 on your phone and you'll be able to speak up. If not, I understand that today and this week, maybe this month or this year, is a bit strange. So it will be absolutely no problem if you want to reach out to us later once you have had time to mull things over. We'll be putting the recording of this presentation as well as Kathy's full slides on the website today. And as mentioned before, all the fact sheets and learning briefs that Kathy introduced and displayed on her screen are available already online. Oh, I hear someone. I hear someone. Do we have a question?
It's Sandy. Can you hear me?
Yes, we can. Hi, Sandy.
I have a question. And you identified some gaps. Where do you see the priority gap being?
Well, speaking with Myrna, the priority gap is gathering more original research, specifically looking at our Canadian population. We can only do so much for drawing conclusions by looking at international studies. So there is a huge gap in what we know about Canadian older adults as victims of sexual assault. Our knowledge is limited to people who report, and we know that is a small percentage of victims. So I think that's where we've gotten direction from from the researchers, that's where we should be focusing, or that's where, pardon me, the next steps should be focused when looking to support older victims of sexual assault.
Okay, thank you.
Anyone else?
We do have a comment that came through on the chat box from
Okay.
Pam Burns. She said, not a question, but great information and resources, and she's challenging each of the participants to share with 5 people or organizations in their respective areas.
That's a great idea. And yes, you can find them all on the website and do share them widely. We have created those fact sheets and those learning briefs for that reason, because not everybody has the time or interest in going through a fairly large literature review. And we've made sure to format all documents so that they are as plain language as possible. So do share them, do print them, put them up where you work. That's a great suggestion, Pam. Thank you very much.
I do want to just sort of reiterate, and that was definitely a focus when we were talking about this project, is recognizing that it is very important to gather that research, gather that information, but also make sure that there are those tools that are a little bit easier to use on a day-by-day basis. Because as I think everyone is aware, it's not necessarily that easy to carve out time to read an extensive literature review as much as we may want to. So having that information in a variety of tools that are public and downloadable was one of the goals of this project.
And meanwhile, I'll do a little bit of a selfish plug while people think on it. We have another webinar coming up next month. So obviously we're back to regular programming. This won't be about the project anymore. But on April 23rd, we'll be hosting a webinar with Dr. Kirsten Roger. So Dr. Roger and her team have been working on a tri-provincial study in the prairies. And they're going to be talking about key aspects about the reasons, like why elder abuse and neglect is often underreported. And they're going to talk about and provide recommendations for enhancing disclosure among older adults experiencing abuse. If you follow us on social media or receive our newsletter already, you might have seen in the past year some calls for participants from Dr. Roger, and this is this very study they're going to present just the preliminary findings and the first takeaways. So we're very excited about this one. This is going to be one that will be focused on the prairie provinces, and it's going to take place on April 23rd, which is also a Thursday, 10 a.m. Pacific, the usual time, and you can already register online. If you want, you can click on the link that's in the slides, and you can also find it under CNPA webinars on our website. Okay, well, if I don't see if there are no other questions, we can maybe let you go and return back to your lives and work, even if that means working from your couch today for some of you. Kathy, any final words?
No, just thank you to the participants of this webinar and to everyone that has supported the CNPA for this project and otherwise. Always appreciated.
All right. On this note, it's my time to thank you as well. I hope you have a great day. Stay healthy, stay safe out there, and we'll be in touch with you very soon. You should be receiving, as a matter of fact, a short survey about this webinar in the next few days. So please do fill it out. It will tremendously help us when we do our final reporting. Thank you so much.
Thank you.
Bye.
Have a great day, everyone.